Hey everyone, and welcome back for another deep dive.
It's great to be here.
Today we're going to be looking at something I think is really, really interesting.
Yeah.
It's the healthcare sector in India, and
It's pretty fascinating stuff.
yeah, so we've got this report, this industry report that came out in November 2024, and it's just packed with all kinds of stats and trends, and
Yeah, it really is an eye-opener.
yeah, it really is. And I think a lot of our listeners will be surprised to find out just how much India is becoming.
A real global powerhouse when it comes to healthcare.
Yeah,
I mean, from, medical tourism to attracting major investments. It's really quite something.
And the market there is already huge.
Oh, absolutely. It's already one of the largest healthcare markets in the world.
Yeah.
In 2023, it was valued at $372 billion US.
Wow.
And projections show it reaching $638 billion by 2025.
So it's almost doubling in just a couple of years.
Yeah, it's incredible growth. A CAG of 22.52%.
Wow. So what's driving that kind of growth?
Well, a lot of it comes down to demand.
Okay.
India has a rapidly growing middle class with rising incomes and also an aging population
Yeah.
and just more awareness of health and wellness overall.
That makes sense.
Yeah, and by 2026, the elderly population alone is expected to reach 168 million.
Wow.
That's larger than the entire population of Russia,
Yeah.
and they're all going to need access to healthcare.
Right. And India is known for being really affordable when it comes to medical care.
Oh, absolutely. Yeah, medical services in India can cost a fraction of what you would pay in developed nations.
So that must be a big driver of this medical tourism that we keep hearing about.
Oh, absolutely. Yeah, people are flying in from all over the world for, high-quality treatments
Wow.
at a fraction of the cost. And it's not just the affordability that's attractive.
Okay.
India is also becoming a hub for research and development.
Really?
Yeah, because it's just so cost-effective for companies to conduct their research there.
So it's like this sweet spot.
Yeah, you could say that.
They've got the high quality but at a lower cost, so
Makes sense.
it makes a lot of sense. And the report also mentioned this massive investment from Temasek.
Oh, yes, that was a big one.
Yeah.
In May 2023, Temasek, which is a major global investment company, invested $2 billion into Manipal Health Enterprises,
Wow.
which is one of India's leading healthcare providers.
$2 billion. That's a serious investment.
It is, and it's a huge sign of confidence from the international community.
Yeah, they're putting their money where their mouth is, right?
Exactly.
That's amazing. And the Indian government is also investing heavily in this sector.
Oh, absolutely. Yeah. They've got some impressive initiatives in place, like the National Health Mission.
Okay.
And their budget for that is, almost 382 billion rupees.
For 2024 or 2025.
Yeah, the 2024-25 year.
That's incredible. So what exactly does the National Health Mission focus on?
It's really all about improving healthcare access across the country,
Okay.
especially for those in rural and underserved areas.
And they're not just building hospitals, right?
No, they're also focusing on preventative care and health education.
Oh, that's great.
Yeah, it's a very holistic approach.
So we've got this incredible growth that's fueled by demand and affordability and government support.
The powerful combination.
Yeah. What does the future hold for India's healthcare? What kind of trends are we looking at?
Well, one of the biggest shifts we're seeing is a move away from communicable diseases and towards lifestyle diseases.
You mean things like heart disease and diabetes?
Exactly. Yeah, those are on the rise in a lot of developing countries.
Right.
As India develops and lifestyles change,
Mhm.
we're seeing the surge in these types of conditions.
So there's a growing need for specialized care.
Absolutely.
And this shift from communicable to lifestyle diseases, it's not just about changing treatments, right?
No, it's completely reshaping the healthcare landscape.
How so?
Well, think about the potential for companies who are developing innovative solutions for diabetes management or cardiac care, specifically designed for the Indian market.
Oh, that's interesting, yeah.
That's a massive opportunity.
So they're not just treating the diseases, they're creating an entire ecosystem around them.
Yeah.
That's amazing. So how is the healthcare system adapting to these new challenges?
Well, for one thing, companies like Metropolis Healthcare and DocPlix are expanding their reach into smaller cities,
Okay.
what they call Tier 2 and Tier 3 cities.
Okay.
And they're making quality healthcare more accessible to a wider population.
That makes sense. But what about people in really remote areas? I imagine it's still difficult for them to access quality care.
You're absolutely right, and that's why the telemedicine boom in India is so significant.
Okay.
It's really transforming healthcare access, especially in rural communities.
So they can get expert advice without having to travel for hours.
Exactly, yeah.
The report actually highlighted HealthNet Global's tele-ICU program,
Oh, yes.
and they're enabling doctors to remotely monitor and provide expert intervention for critically ill patients in different locations.
Very amazing.
Yeah, it's life-saving stuff.
It is. And it's
Yeah.
not just about reaching remote areas.
Mhm.
Telemedicine is also making healthcare more convenient and efficient for everyone.
Right, you can consult with a doctor from home.
Exactly.
Save yourself the travel time.
Yeah, saves you time and hassle.
Yeah, for sure.
Yeah.
And we also touched on AI integration in the report.
Oh, yeah. AI is huge in India right now.
Really?
Yeah, they're rapidly adopting artificial intelligence in healthcare.
So what exactly are they using it for?
Pretty much everything from patient diagnostics and treatment planning to hospital administration and efficiency.
Wow, so they're using AI to kind of streamline the whole system.
Absolutely. And it's only going to grow.
And the report said they're projected to spend almost 12 billion US dollars on AI in healthcare by 2025.
Yeah, that's the projection.
That's a huge investment.
It is.
It sounds like India is really embracing technology to improve healthcare delivery.
Yeah, they are.
Are there any other major trends we should know about?
Well, we touched on medical tourism earlier, but I think it's worth diving a little deeper.
Yeah.
India is attracting over 500,000 international patients every year.
That's incredible what makes it such a popular destination.
Well, we've talked about affordability,
All right.
but they also have some of the best hospitals and doctors in the world.
Really?
Yeah. And many of them are trained in the West.
Wow.
So they offer cutting-edge treatments and technologies, often at a much lower cost.
I read that India is actually ranked 10th in the medical tourism index.
Oh, yeah. They're right up there.
And the government is really encouraging this trend with the e-medical visa initiative, which covers 167 countries.
Yeah, it's a smart move because medical tourism is projected to contribute 10 to 12% to hospital revenue in India.
Wow.
And that's exceeding overall industry growth.
So it's a major economic driver for them.
Absolutely. Yeah, it puts them on the map as a global healthcare leader.
Yeah, it really does. So we've talked about the growth, the factors driving it, and these exciting trends, but what does this all mean for our listeners?
Well, I think if you're interested in healthcare innovation or investment, India is a market you can't ignore.
Yeah, the opportunities seem endless.
Yeah, there's huge potential for entrepreneurs and tech professionals to make a real impact with the rise of telemedicine and digital health.
And let's not forget about the benefits for patients.
Oh, absolutely. Yeah, high-quality care at significantly lower costs.
Yeah.
It's becoming a more and more attractive option.
So if you're considering medical tourism,
Yeah,
India is worth exploring.
definitely.
It's interesting because you've got this cutting-edge technology, but they also have this rich tradition of medicine, especially with Ayurveda.
Yeah, it's a fascinating convergence. You've got technology and tradition coming together.
Yeah, so how might this reshape the future of healthcare?
That's a great question. How will this convergence, combined with the ever-increasing demand for healthcare services, how will it reshape the future of healthcare, not just in India, but globally?
It's a big question.
It is, and it makes you wonder about the potential for international collaboration and the role it could play in this evolution.
Yeah, it really does make you think about all the possibilities.
There are a lot of them.
Yeah, I'm already thinking about all the things we could talk about in our next episode.
Oh yeah, there's a lot more to uncover.
Yeah, so before I move on, I want to encourage our listeners to check out the full industry report.
Yeah, it's definitely worth a read.
It's packed with details and insights we didn't have time to get to today, and we'll include a link in the show notes.
Yeah, and we'd love to hear your thoughts.
Yeah, what stood out to you the most? What questions do you still have?
Connect with us on social media or send us an email.
We're always excited to keep the conversation going.
Absolutely.
So until next time, keep those brains buzzing, and we'll see you back here soon for part 2 of our deep dive into the world of healthcare in India. See you then! Welcome back to our deep dive into India's healthcare revolution. In the last part, we talked about the incredible growth, the major investments, and the exciting trends that are shaping this sector.
We covered a lot of ground, but there's still so much more to explore. Right, today, let's kind of shift gears a little bit and look at some of the inner workings of India's healthcare system. It's a complex landscape with both incredible opportunities and some persistent challenges.
One thing that really jumped out at me in the report was the healthcare worker shortage. India has this rapidly growing population, but they don't seem to have enough doctors and nurses to keep up.
Yeah, you've hit on a really critical point. The report highlights that India has a mere 1.7 nurses for every 1,000 people and a doctor-to-patient ratio of 1 to 1,500 nationwide.
Wow, those numbers are pretty alarming. So how are they tackling this workforce shortage?
Well, it's not a simple solution. It's not just about training more doctors and nurses. There are a lot of factors at play, including distribution and utilization of existing talent.
Okay, so they're not just starting from scratch.
No, not at all.
Yeah.
India actually already has a large pool of well-trained medical professionals. In fact, the number of registered doctors has been steadily increasing.
So they have the talent, but it's not evenly distributed or fully utilized.
Exactly. That's one of the key challenges.
So what are the roadblocks? What's preventing them from making the most of this talent?
Well, one challenge is that a lot of healthcare professionals, particularly doctors, tend to concentrate in urban areas.
So that leaves the rural communities underserved.
Exactly. And there's also a need to improve the quality of medical education and training in some areas.
So it's about attracting talent to underserved areas and then making sure they have the right skills.
Exactly.
Okay, so what are some of the steps the government is taking to kind of address these issues?
Well, they're tackling it from several angles. One approach is to expand medical education and training opportunities.
So are they building more medical schools?
They've been establishing new medical colleges at a pretty impressive rate. In 2024 alone, they added 60 new colleges.
Yeah, that's a significant increase.
It is, and it resulted in a boost to the number of MBBS seats, which are essentially their medical school seats,
Okay, yeah.
by over 6%.
Wow, so they're really serious about this.
They are, and it's not just about quantity. They're also working to improve the standards of medical education.
Makes sense. They want to make sure those graduates are equipped to handle the evolving needs of the healthcare system.
Exactly, and they're also implementing programs to incentivize healthcare professionals to work in rural areas.
So they're making those rural positions more attractive.
Right, offering financial incentives and other benefits to kind of sweeten the deal.
Now, the report also mentioned something about the global demand for Indian healthcare professionals.
Oh, yeah, that's a fascinating trend.
Can you tell us more about that?
Sure, so the demand for Indian doctors and nurses is actually expected to double both nationally and globally by 2030.
Double! Wow, that's huge. Why such a big increase?
Well, it's a few things. We've talked about the shortages in India, but many developed countries are also facing their own healthcare worker shortages.
Especially as their populations age, right?
Exactly. And Indian healthcare professionals are highly skilled and often speak English, which makes them very sought after around the world.
So India is almost like a training ground for global healthcare talent.
In a way, yes. And it's not just about filling workforce gaps. It also creates opportunities for knowledge transfer and collaboration between India and other countries.
So when these professionals go abroad and then return home, they bring back new skills and perspectives.
Exactly. It's a kind of global exchange of knowledge and skills.
That's really interesting. So we've talked about the demand side of healthcare in India. What about the supply side? What are companies doing to meet these growing needs and provide quality care to such a massive and diverse population?
Well, we already touched on some key strategies, like expanding into those Tier 2 and Tier 3 cities.
Right. They're recognizing the huge potential in those smaller cities.
Exactly. And this expansion isn't happening by accident. There are some specific factors driving this trend, like rising incomes in those areas, better infrastructure, thanks to government initiatives, and even government incentives to encourage healthcare investments outside of major metropolitan areas.
So it's not just market forces at play. The government is actively encouraging this expansion into these smaller cities.
Absolutely. And it's not just about building new hospitals. They're also focused on delivering healthcare in new and innovative ways, like DocPlex, which is this health tech startup that's digitizing health records and using AI to enhance healthcare accessibility.
It's great to see these kinds of tech-driven solutions that are bridging the gap between urban and rural healthcare.
Yeah, it's really making a difference.
We briefly mentioned Ayurveda earlier, but I think it's worth exploring the role of traditional medicine in India a little bit more.
Definitely. Ayurveda is a huge part of India's healthcare landscape. The Ayurveda industry in India is worth over $50 billion US.
Wow, that's a massive market.
It is, and it's growing rapidly.
What's driving that growth?
Well, there's this growing global interest in holistic and alternative medicine. People are looking for natural and traditional remedies, and Ayurveda fits perfectly into that trend.
It's like a back-to-basics kind of approach.
Yeah, you could say that, and it's not just about traditional treatments. Ayurveda is expanding to include a wider range of services like diet and nutrition counseling, yoga, and even spa treatments.
So it's more of a lifestyle approach, a way to promote overall well-being.
Exactly, and you mentioned spa treatments. That's a good example of the growing wellness tourism segment within the Ayurveda industry.
So people are traveling to India specifically to experience Ayurvedic treatments and therapies.
Exactly. Often at these luxurious resorts or wellness centers, it's a combination of relaxation, rejuvenation, and healthcare all in one.
Sounds amazing. So we've got this ancient practice experiencing a modern revival, but how does the Indian government view Ayurveda? Is there any official recognition or regulation of this industry?
Oh, yes, definitely. The Indian government has been actively promoting Ayurveda and other traditional healthcare systems through what they call the Ministry of AYUS.
The Ministry of what?
AYUS, it stands for Ayurveda Yoga and Naturopathy, Unani Siddha, and homeopathy.
That's a mouthful.
It is, but it shows how seriously they're taking these traditional practices.
It's interesting that they're grouping all those different systems under one umbrella.
Yeah, it's all part of their effort to promote what they call holistic healthcare, recognizing that these different systems can actually complement and enhance each other.
So it's not about replacing modern medicine. It's about integrating different approaches to create a more well-rounded healthcare system.
Exactly.
What are some specific steps the government is taking to support the AYUSH sector?
Well, they've set up a dedicated department to research and standardize traditional medicines, making sure they're safe and effective. And they're also working to create a digital library of traditional knowledge, a way to protect this ancient wisdom from being exploited by foreign companies.
That's important to preserve that knowledge and make sure it's used ethically.
Absolutely. And they're also providing financial support.
Yeah.
They've allocated funding to upgrade AYUSH centers to make them more accessible, more modern, and equipped to meet current standards.
So they're putting their money where their mouth is.
They are. And they're also providing financial assistance to small and medium-sized enterprises, or SMEs, that are involved in the manufacturing and marketing of AYUSH products.
So they're really trying to nurture this industry, but as with any industry, there must be some challenges they're facing.
Of course, one of the main challenges is ensuring the quality and safety of traditional treatments you see. Unlike modern pharmaceuticals, which undergo rigorous testing and regulation, traditional medicines often rely on centuries-old practices and formulations.
I see how that could be an issue. So how do they address these concerns about quality control and safety?
Well, there's a growing recognition that they need more research and standardization to make sure these treatments are both effective and safe.
So they're trying to bring traditional knowledge and modern science together.
Exactly. And that leads to another challenge, integrating traditional medicine into the mainstream healthcare system.
Because right now they're kind of operating separately.
Yeah, you could say that, but there's a growing movement to bridge that gap and create a more integrated approach to healthcare.
So are they like teaching Ayurveda in medical schools now?
Some medical colleges are starting to incorporate Ayurveda and other traditional systems into their curriculum.
So future doctors will have a broader perspective.
Exactly. And some hospitals are even offering integrated healthcare services that combine the best of both worlds. So a patient might receive conventional medical treatment alongside Ayurvedic therapies or dietary recommendations.
Oh, that's interesting. It's about recognizing that both systems have their strengths and using them together to create a more holistic and effective approach to care.
Exactly.
This whole conversation about healthcare in India has been really eye-opening. It's amazing to see this blend of modern and traditional approaches and the use of technology to improve access and quality.
It really is a unique and dynamic system.
But before we get too carried away with the excitement, I think it's important to remember that no system is perfect.
You're absolutely right. There are still challenges that need to be addressed.
So what are some of the areas where the Indian healthcare system could be improved?
Well, one persistent issue is the disparity in healthcare access between urban and rural areas. We talk about how companies and the government are trying to bridge this gap, but it's clearly an ongoing challenge.
Why is it so difficult to ensure equitable access to quality healthcare across such a vast and diverse country?
Well, it's a number of factors. For one thing, India is a huge country geographically, and reaching those remote communities can be logistically challenging.
Makes sense. Those rural areas often lack the infrastructure, the medical professionals, and the resources that you find in cities.
Exactly. And it's not just about geography. There are also socioeconomic disparities that need to be addressed. People from lower socioeconomic backgrounds often face barriers to accessing quality healthcare even in urban areas.
So it's a really complex issue. What can be done to address these disparities and create a more equitable system?
It really requires a multi-pronged approach. Continued investment in rural healthcare infrastructure is crucial, along with programs to incentivize those healthcare professionals to work in those underserved areas.
So it's not just about building hospitals, it's about attracting the talent and creating a supportive environment.
Exactly. And we also need to address the social determinants of health, Things like poverty, lack of education, and social stigma, which can all impact a person's ability to access healthcare.
So it's about looking beyond just the healthcare system itself and addressing those broader social and economic factors.
Absolutely. It's a complex issue, but it's one that India is actively working to address.
So we've talked about disparities in access, but what about the overall quality of healthcare in India? How does it compare to more developed nations?
It's a tough question to answer. There's no easy comparison. India has some of the best hospitals and medical professionals in the world, offering treatments and technologies that rival anything you'd find in the US or Europe.
Okay.
But the quality of care can vary quite a bit depending on where you are, what type of facility you're at, and the specific doctor you're seeing.
So it's really important to do your research, especially if you're considering medical tourism.
Oh, absolutely. And remember, quality isn't just about technology and facilities. It's also about the patient experience. Things like communication, compassion, cultural sensitivity, and overall patient satisfaction play a huge role in how people perceive the quality of care.
Right. So it's not just about the clinical side of things, it's about the human element.
Exactly. And how is India doing in this area?
Hmm.
Well, they're making progress. A lot of healthcare providers are recognizing the importance of patient-centered care, and they're actively working to improve the patient experience.
That's encouraging.
Yeah, they're implementing training programs for staff, focusing on communication skills and cultural sensitivity, and they're incorporating patient feedback into their quality improvement initiatives.
So they're really trying to create a more holistic, patient-centric approach to healthcare.
Exactly, and that's something that's becoming more and more important in a globalized world where patients have more choices and higher expectations.
This whole deep dive into healthcare in India has been really eye-opening. I mean, we've seen incredible innovation, a dynamic market, and a real commitment to improving the health and well-being of the population.
I agree, it's a complex and evolving landscape, but it's clear that India is on a really exciting journey.
But before we get too caught up in the excitement, let's take a step back and acknowledge that there are still some challenges ahead.
You're right, ensuring equitable access to quality healthcare for everyone remains a top priority. And there's still work to be done to strengthen the healthcare infrastructure, particularly in those rural areas. And we also need to find ways to manage the rising costs of healthcare as the demand for those specialized services keeps growing.
It's a balancing act, isn't it?
It is. It's about balancing the need for growth and innovation with the imperative of making sure that healthcare is affordable and accessible to everyone.
A challenge that pretty much every healthcare system in the world is facing.
It's a delicate balancing act.
This brings us to a question that I think is on a lot of our listeners' minds. What about the future of healthcare in India? What does the next chapter hold for this rapidly evolving sector?
That's the million-dollar question. And it's one that we'll explore in more detail in our next episode. We'll delve into the emerging trends, the potential breakthroughs, and the challenges that lie ahead. But for now, let's leave our listeners with a bit of a cliffhanger.
And welcome back to the final part of our deep dive into healthcare in India. It's been quite a journey.
It really has. We've covered so much ground.
We have, from the booming medical tourism industry to those challenges of providing equitable access to quality care for such a huge and diverse population. It's been fascinating.
Absolutely. And one thing that's become crystal clear throughout our conversations is India's ambition to become a global healthcare leader.
Yeah, they're not just trying to provide for their own people, they're aiming to make a real impact on the global stage.
Exactly. And it's not just about providing healthcare services, they're also positioning themselves as a hub for healthcare innovation.
So they're not just catching up, they're actually leading the way in some areas.
Right. And we're seeing incredible advancements in technology, pharmaceuticals, medical devices. It's really impressive.
So in the last part, you mentioned that India is almost like a training ground for healthcare talent with so many Indian doctors and nurses in high demand all over the world.
Exactly. They're exporting expertise and knowledge, which benefits everyone.
It's a win-win situation. And speaking of winning, India is also attracting a lot of investment in the healthcare sector.
Oh, absolutely. The government has been very strategic about creating a favorable environment for foreign investment, and it's paying off.
The report mentioned a significant increase in foreign direct investment, or FDI, in healthcare.
Yeah, between April 2000 and June 2024, the FDI inflow for the drugs and pharmaceuticals sector alone reached over 22 billion US dollars.
Wow, that's a lot of money pouring into the sector.
It is,
Yeah.
and it's a clear indication of the confidence that global investors have in India's potential.
What's attracting all this interest? Is it just the lower cost?
Lower costs are definitely a factor. But it's not the only reason. India also has a huge pool of scientific talent. world-class research institutions, and a rapidly growing domestic market.
Right, so it's a combination of factors that make India so attractive to investors.
Exactly. And it's not just about the money, it's about the potential to make a real difference in the world.
Speaking of making a difference, let's talk about some of the exciting innovations coming out of India. Are there any specific examples that really stand out?
Oh, there are so many. It's hard to choose just a few. But one area that's particularly exciting is the integration of technology into healthcare.
We talked about telemedicine and AI before, but it seems like there's a lot more going on.
Absolutely. For example, there's a partnership between Cognizant and Microsoft to integrate healthcare products with the Microsoft Cloud.
So that would make it easier for healthcare providers to access and share data.
Exactly. And it would enhance security and collaboration, which are essential in healthcare.
That's amazing. And then there's IIT Bombay, which is working with blockchain for impact to develop affordable healthcare technologies.
Yeah, they're exploring the use of blockchain technology for things like securely storing and sharing medical records, tracking the supply chain of pharmaceuticals, and even streamlining insurance claims.
It sounds like they're really pushing the boundaries of what's possible.
They are, and it's not just about high-tech solutions. They're also focused on developing affordable and accessible solutions for everyone.
That's really important because technology should be a tool to improve healthcare for everyone, not just a select few.
I agree, and it's inspiring to see how these cutting-edge technologies are being used to address real-world healthcare challenges in India.
Absolutely. And speaking of addressing challenges, let's not forget India's role in the fight against COVID-19.
Oh yes, they were a crucial player in the global response to the pandemic.
They not only developed and manufactured vaccines, but also exported them to countries in need.
Yeah, as of July 2023, India had exported over 3 billion vaccine doses.
That's incredible. They really stepped up to help the world during a time of crisis.
They did, and their global engagement goes beyond just vaccines. India is actively participating in international initiatives to strengthen healthcare systems, promote research collaboration, and address emerging health threats.
So they're really taking a leadership role on the global stage.
Absolutely. They're sharing their expertise and resources with the world, which is commendable.
So we've covered a lot of ground in this deep dive. The government's role, the influx of investment, the incredible innovations, and India's growing presence in the global healthcare arena. But as we wrap up this episode, the big question is, what about the future?
Right. Where do we go from here? What does the next chapter hold for India's healthcare sector?
What can we expect to see in the coming years?
Well, one thing's for sure, India's healthcare sector is going to keep growing. The demand for healthcare services is only going to increase as the population grows, incomes rise, and people live longer.
So more growth, more innovation, more opportunities.
Yes, I will likely see even more advancements in telemedicine.
Oh.
AI personalized medicine and the medical devices sector is also poised for significant growth.
It sounds like the future of healthcare in India is incredibly bright.
It is, but as we've discussed throughout this series, there are also challenges that need to be addressed.
Right. Ensuring equitable access to quality healthcare for everyone remains a top priority.
Absolutely. And there's still a lot of work to be done to strengthen the healthcare infrastructure, particularly in rural areas. And we also need to find innovative ways to manage the rising costs of healthcare.
It's about finding that balance between progress and accessibility.
Exactly. And it's a challenge that every healthcare system in the world is facing.
It's been an incredible journey exploring the world of healthcare in India.
I agree, it's a complex and evolving landscape, but one that holds immense promise.
Before we sign off, I want to remind our listeners to check out the full industry report that we've been referencing. It's full of fascinating details and insights, and we'll include a link in the show notes.
And as always, we'd love to hear your thoughts. What resonated with you? What questions do you still have?
Connect with us on social media or send us an email. We're always eager to continue the conversation.
Thanks for joining us on this deep dive into healthcare in India.
Until next time, stay curious and keep exploring.